knock, knock. Hand hygiene for 20 seconds. Hi, my name's Christina. I'm going to be the student nurse working with you today. How are you doing today? Good. Can I get your name and your date of birth, please? Jackie Rogers, December 2nd, 1960. Okay, thank you very much. And how are you doing today, Mrs. Rogers? Oh, good. I'm doing well. Thank you for asking. Okay, so we're just going to finish cleansing my hands just a little bit, and I'm going to check your wristband in just a moment just to identify you. Okay. Let me check your wristband. Perfect, that matches. And Mrs. Rogers, before we begin today, do you have any allergies to anything that I should be aware of, particularly anything like chlorhexidine, iodine, latex? No? Okay, and then are you experiencing any discomfort or pain at the moment? A little discomfort in the bladder area? Yeah, you are having some urinary retention, right? Okay, so I'm here to help you with that today. So I'm going to be doing a Foley catheter insertion. Have you had this procedure done before? You have? Okay. So I just want to go over a little bit with you what we're going to be doing today. So I'm going to be cleansing the perineal area, and then I'm going to insert the Foley catheter, and that's going to go into the urethra and then into the bladder. And then once that's in the bladder, I'm going to inflate a balloon, and the balloon is going to help keep it in place so you're able to move around comfortably. And then I'm going to stabilize the catheter to the thigh area, and then so that's going to keep that in place. Okay, and then do you have any questions with me before we begin? No questions? Okay, so just want to let you know the procedure's fairly painless. You might have a little bit of discomfort, but if you do have any pain or if it's too intolerable at any moment, please let me know and we can see what we can do from there, okay? Okay, so I do need you in a supine position, so you already are in that position, which is great. I'm going to go ahead and close this curtain to give you some privacy. And no questions for me? Okay, great. I'm going to get my table set up and I'll be right with you, okay? Thank you. Close my hands for 20 seconds. First pair of gloves. I'm going to clean my table for 30 seconds, 30 full seconds, making sure I get every part of the table that I'm working on. Have you had any visitors today, Mrs. Rogers? Your husband and daughter? Oh, nice. I'm sure you were very happy to see them and they were happy to see you. Okay, make sure I get all parts of the table, including the outside edges of the table as well. Okay, so after I'm done cleaning that for 30 full seconds, I'm going to let that dry for 2 full minutes. Hand hygiene for 20 seconds. My next pair of gloves. Since my table's done drying for 2 minutes, I'm going to go ahead and put my sterile kit on there. And Mrs. Rogers, I'm going to begin cleansing the perineal area, so I'm going to go ahead and pull the blanket down and lift your gown up, okay? Is that okay? Yeah? Okay, thank you. And the wipes might be a little bit cold, but I will do it quickly. Okay, and then I'm just going to frog your legs in a position like this, just to make it easier. And then if you can go ahead and just stay in this position for me for the remainder of the procedure. And is it okay if I lift the gown up? Yeah? Okay, thank you. Okay, so I'm going to begin cleansing the perineal area. So I'll clean one side of the labia, front to back. Next side of the labia, front to back. And I'll cleanse the middle as well. Are you doing okay? Okay, great. And then is it okay if I leave you exposed like that before we begin? Yep, okay, thank you. Okay, so I will remove my gloves. Hand hygiene for 20 seconds. Next pair of gloves. Okay. And then I'm going to begin by taking my sterile kit out. Mrs. Rogers, I'm going to put this drape on you. I'm going to make sure that I have the shiny side down. Okay. And I'm going to get rid of this because I don't need it. And I'm going to go ahead and drop my items into my sterile field. Syringe. Got my stabilizer and my prep pad. And my alcohol pad. Okay, perfect. And I got my sterile gloves on this table over here. I'm going to remove my gloves from hand hygiene, and I'm going to begin to put my sterile gloves back on. And make sure I only touch the outside 1-inch border of the paper. That cuff for just a moment. I'm cuffing the sterile gloves. That's it. Go ahead and get rid of that. And my items on here. Okay, so I'm going to begin by putting my sterile water syringe on my port. I'm going to take my urine cup. I'm going to unloosen the cap just a little bit and set that right there. And I'm going to take my lubricant. And the Q-tips, break that off, set that in there. Okay, Mrs. Rogers, we're going to begin now. I'm going to go ahead and put the kit in between right here onto the drape. And then I'm going to begin by cleansing the perineal area again, so I'm going to go ahead and just put that there. You doing okay so far? Okay, good. So on one side, and the next side, and on the middle as well. Doing okay so far? Okay, good. So I'm going to begin by inserting the catheter for you. So I'm going to go ahead and I'm going to have you count to 3. So 1, 2, 3. I'm going to have you take a deep breath in, and then when I get to 3, deep breath out, okay? And just blow out. All right? Okay, are you ready? Okay, fantastic. Okay. All right, ready? And 1, 2, 3, blow out, blow out, blow out, blow out. You are doing great. Okay. All right, and perfect. It looks like I did get some, I see some urine in there, so I'm able to advance the catheter 2 more inches. So go ahead and advance that a little more. And you're doing okay so far? Okay, fantastic. All right. And then, okay, so I'm going to go ahead and inflate the balloon. Okay. You're doing okay? Okay, just keep breathing. You're doing fantastic. Okay, good job. Go ahead and remove that. And then I'm going to pull back a little bit and just make sure. Okay, perfect. So I am feeling a little bit of resistance, so that's great. So that means that it is in place. And then I'm going to go ahead and grab my alcohol and clean the port. Go for 15 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. Okay, great. And then I'm gonna let that dry for 15 seconds. And I'm gonna go ahead and take a urine specimen as well. You doing okay? Okay, good. I'm gonna go ahead and take out 10 cc's of urine. Okay, move that over there. Fantastic, you did fantastic. Okay, Mrs. Rogers, so I'm gonna go ahead and get the stabilizer on your leg now too. And I'm going to put that there, and then I'm gonna go ahead and just put the, take these gloves off. Okay. I'm gonna hand hygiene for 20 seconds, and then I'll put some clean gloves on. Okay, and then I'm gonna clean the area. I'm gonna clean the area with this skin prep pad. So this is just gonna keep the stabilizer attached to your leg, okay? Just put that there. And then go ahead and there, okay, and then going to attach that to the port. To secure that on the tie right there. You doing okay so far? Okay, fantastic. And then I'm gonna go ahead and just put this bag. I'm gonna secure this on the side of the bed for you over here, and then just to make sure that we get that the gravity pulls the urine down, and I'm gonna lock this on the side of the bed. Okay. And you did a great job. Okay. And we'll go ahead and remove this from the area, toss it in the trash. I'm going to take my gloves off. I'll put some sanitizer on. I'm going to put some clean gloves on. Okay. And then I'm just going to position your legs back. Okay, are you doing okay so far? Okay, good, you did great. Okay, cover you up, and then I'll put your blanket back on you as well. Okay, and then I'm just gonna be right here getting the urine specimen, okay? So then I'm going to collect my urine specimen. It's gonna be 10 cc's of urine into my cup, making sure that I don't touch the inside of the cup. And I'm going to keep this here for now. And I'm going to document that I put the patient's medical record number, their name, the date and time of the collection, and I collected 10 cc's of urine. It was clear yellow urine with no sediment. And I'm going to go ahead and remove my gloves and hand hygiene. And Mrs. Rogers, before I take my urine to the lab, I'm going to go ahead and put your bed in the lowest position. I'm going to raise your side rails, and you have your call weight. And are you feeling okay right now? You're good? Any questions? Okay, fantastic. All right, thank you so much. I will see you soon. I'm going to make sure that I document all of this, that the patient tolerated the procedure well. I used a French 16 catheter, and that it was clear yellow urine with no sediment. And the date and the time as well, and the patient's name and medical record number. And I will take this to the lab. I'll clean my area up. Taking that to the lab right there, dropping my stuff, hand hygiene, and I'm done. Knock, knock, knock. Okay, put my supplies right here. And hand hygiene for 20 seconds. Hello, my name's Christina. I'm the student nurse working with you today. How are you doing today? Good. And can I have your name and your date of birth, please? Jackie Rogers, December 2nd, 1960. Okay, thank you, Mrs. Rogers. Having a nice day so far? Good. I'm also doing well, thank you for asking. Okay, and then I'm just gonna go ahead and check your wristband, Miss Rogers, just to identify you. Okay, perfect. Everything matches. Thank you very much. And Mrs. Rogers, before we begin, I just want to ask you a couple questions. Do you have any allergies to anything that I should be aware of, particularly anything like latex, chlorhexidine, tape, anything like that? No? Okay, fantastic. And are you experiencing any pain or discomfort at the moment? None? Okay, great. So I'm going to be doing a Foley catheter removal for you today. Have you had this procedure done before? You have? Okay, so you are aware when I remove the catheter, you might feel a little bit of a burning sensation, but it's fairly quick and pretty easy. So just let me know if you have any trouble doing it, okay? And I just want to make sure that you are in the lowest position, the supine position. Perfect. Do you have any questions for me at all? No? Okay, great. And then I'm going to go ahead and just close your curtain, give you some privacy, and then I'm going to get my supplies ready. I'll be right with you, okay? Okay, thank you. Hand hygiene, 20 seconds. Put on my gloves. Okay, and Mrs. Rogers, I'm just going to go ahead and pull your blanket down and then lift the gown up. Is that okay? Okay, thank you. Okay, is it okay to lift this up? Yeah? Okay, thank you very much. Okay, just going to assess the site really fast. Okay, everything's looking good, no redness or anything. Okay, and then I'm going to go ahead and just frog your legs in this position, and we'll just keep it like this for the remainder of the procedure, and I will change them back when we're done. And I'm going to put this chucks between your legs. Perfect. Okay. And hand hygiene, or I'll take my gloves off. Hand hygiene, 20 seconds. I'll put my next pair of gloves on. Syringe here that I'm gonna drop. Okay, perfect. I'm gonna get my alcohol wipe, and I'm gonna begin by removing just the adhesive from the stabilizer right here because it does get pretty sticky on there. Okay, are you feeling okay so far? Okay, great. Okay, perfect. And then go ahead and unclip that. Set this to the side right here. Okay. And then I'm going to begin with the saline removal. So I'm going to have you go ahead and just take a deep breath in for me and then a deep breath out, okay? Okay, and then I'm going to remove the saline solution. Gonna discard that in there, and then I just want to make sure that I got everything out, so I'm going to go ahead and put that back in. Make sure I got the full 10 milliliters out that I put in before. Okay, perfect. Everything's coming out. Fantastic. Okay. And Mrs. Rogers, I'm going to begin with the removal, so I'm going to have you go ahead and just take a deep breath in for me, and then a deep breath out, okay? And then we're going to begin that, okay? Ready? And on the count of 3, deep breath out. 1, 2, 3. Perfect. Okay, fantastic. You did great. Go ahead and get this. And I got that adhesive off, so I'm going to toss that out. And I'm going to go ahead and take this to the bathroom really quick, and I'm going to go ahead and measure this. I'm going to measure the urine in a graduated cylinder, and I'm just going to make sure that I document everything and then see what you got, okay? And then I'm going to put this, discard this in the proper receptacle as well, okay? So I'm going to go ahead, take that to the bathroom, put it in the graduated cylinder. I'm going to come back and I'm going to discard that. in the trash. Okay, and then I want to, I'm gonna go ahead and put your legs back in the position. Okay. Put your legs back in position. Okay. And put your gown back up. Over you. Put your blanket on. Are you doing okay so far? Okay, good. You handled that very well. Okay. So I just want to document everything that I saw in the urine bag. So there was 500 milliliters of urine in there. It was clear yellow urine. No odor that I noticed. No sediment. I'm going to be documenting that with the patient's medical record, the date and time, and I'm going to remove my gloves, perform hand hygiene, and then Mrs. Rogers, I just want to let you know before you, the next time that you void, I just want you to make sure that you call me in because I want to make sure to see if you have any bleeding or burning or anything like that at all, and you could have a little burning sensation for the next 2 times, but that's totally normal. But if you do notice any chance that you're not able to urinate or there's any blood in the urine or any severe pain or anything, please let me know. And then I just want to make sure too that I do know the next 2 times that you urinate so I can measure the volume of the urine as well, okay? And do you have any questions for me at all? No? Okay, well you tolerated that procedure very well. I'm going to make sure that your bed's in the lowest position. You have your call light in hand, your side rails are up, and you're feeling okay? No pain? Okay, fantastic. Thank you very much. I'm going to go ahead and perform hand hygiene, and I'm going to make sure that I'm documenting the date and time that I removed the Foley catheter, the patient's tolerance of the procedure. I'm going to describe the amount of the urine observed, which is 500 milliliters in the Foley bag. I'm going to describe the next 1 to 2 times that they void. The urine was clear yellow urine, no foul odor of any kind, no sediment, and the patient tolerated the procedure beautifully. Thank you.